Well, May is Mental Health Awareness Month, and we're out here visiting again at Gulfport Behavioral Health System. And we love coming out here and finding out the great things that they do for folks. Eric Bowers is the Military Veterans Liaison here.
Yes,
How are you, sir?
I'm
good to see you.
Thank you. Thanks for having me.
Tell me a little bit about yourself and what you do here.
Okay. Well, I'm a 28-year active duty Army military vet. I am the military veterans and now first responders business development liaisons. So basically my job is to be the link between the active duty service members that's located stationed here at Keesler and of course at NCBC and also within our state with our veterans.
Now there are, you mentioned first responders.
Yes.
A lot of people may not think about that, but they deal with a lot of stressful things all the time.
Absolutely. Well, with our first responders program, we focus on them because we know they're dealing with help protecting our community, so they may be dealing with some stressful situations similar to what we see in the military as well. So we provide a safe unit for them here at our hospital, which is a separate wing that's dedicated just for our military and veterans and first responders to get them the specialized treatments they may need so they can get back in the field to continue protecting the community. And
that's one of the things that us as a civilian, I was never in the military. I am a part-time first responder.
Yes.
But you know, knowing what that they deal with, both the military and first responders and veterans. I mean, yes. It's something that things that they can hold inside of them for years.
Absolutely.
That you help them cope with.
Absolutely. Well, our unit is, as we call it, the Eagles View unit, and the unit is 18-bed unit that we provide that's separate from the other part of the hospital. So it's specialized treatment that focus on getting the treatment, especially with our military, active duty military unit. The goal is to get them this treatment they need so they can get back into uniform, but maybe step down into an outpatient care and then get them back in the uniform.
So they don't have to be veterans, they can be active duty.
They can be active duty, yeah. It's dedicated simply for active duty veterans and first responders. We're focused on, with our veterans, Compact Act, which is dedicated for any veterans that may be experiencing suicidal crisis or issues. They can come here and get treatment for free. The VA pays for it. They don't have to be enrolled in the VA. They can be seen for 30 days or outpatient for 90 days.
That's awesome.
Yeah.
Eric Bowers, thank you so much for some great insight here.
Appreciate
great work being done here at Gulfport Behavioral Health System.
Yeah.
Now, there's a lot of great career opportunities that are available here at Gulfport Behavioral Health System. We're talking to now Cynthia Render-Leach, who's the Director of Human Resources. How are you?
Very good. Thank you again.
Tell us, thank you very much. Tell us about some of the employment opportunities here.
Absolutely. We actually have wonderful opportunities for some nursing team staff, mental health techs. We've created a new position for a coder who's going to be joining our medical records team. So this is a brand new created position. Family nurse practitioners, recreation therapists, helping with our therapeutic recreation opportunities. So we do have a cook position, which is kind of unusual for us. So someone who likes to work in the kitchen, and that will be a full-time opportunity as well.
I was going to say, that's me. I love to cook. I do love to cook. I don't know if they like it, but I love to cook anyway.
We'll put you to work then. That's awesome.
Talk about a couple of the community projects.
Absolutely. So not only do we assist not just our patients here within the hospital, part of our employee engagement committee, we have a committee that's robust, people from all of our departments that participate in it, but we help support community agencies. Currently we're working with the Women's Shelter, the Gulf Coast, it's the Women's Resource Center and the Shelter for Nonviolence. We're going to be doing some fundraisers for Mother's Day, so we're partnering with Movers for Mom and collecting items that would benefit the women that are staying and other people that are staying at the shelters. But also we participate in other things, you know, walks throughout the year, the Out of the Darkness walk. But many of the things that we do that are service oriented actually serve our patients. We do a lot during the time for Christmas, some of the holidays we do. Our staff actually helps to fund all of those service projects with our patients.
Now, if somebody's interested in a job here, what do they do?
Absolutely. So the best thing for them to do is to go to the Gulfport Behavioral Health System career site. All of our jobs are posted there. My name is actually posted on there as well, so that if they were interested and needed to reach out to me directly, they could contact me in the Human Resources office. But all of our careers, both full-time, part-time, and PRN, are listed actually on our careers website.
Cynthia, thank you so much.
Thank you.
Appreciate it.
All righty.
Dean Doty, CEO, how are you? It's good to always come out here and talk to you about the great things that are going here at Gulfport Behavioral Health System. Talk about the substance abuse program here.
Okay. Jim, in America, about 1 in 5 people are suffering with a substance use disorder, be it a mild, a moderate, or a severe issue. And of those that suffer, about 94% do not receive treatment. So only about 6% of those who are suffering with substance use disorders actually receive treatment. You know, I think there's a huge stigma out there. People are afraid to ask for help because they, think they may have some, severe legal consequences if they do. And a lot of folks are using substances in a way to self-medicate maybe some mental health problems as well.
And that's one of the things that you do when they come out here, is you kind of dig deep and find out what's causing them to abuse these substances, whether it's alcohol, whether it's drugs or anything like that. It could be pain pills or anything. There's so many different things.
Yeah, so folks will come here to get a full assessment, and we will look to give them different levels of care. So we have a detoxification program for medical detox, because there are certain substances like alcohol or benzodiazepines that are very, very dangerous to come off of, and they can put someone in jeopardy. And then we have a short-term stabilization here where patients will stay anywhere from 7 to 14 days, and then after that they can step down to our partial hospital program, where we have right off-site boarding, where they can actually stay here for up to 30 days but receive treatment as well. We, in addition, we offer medication-assisted treatment for those who are suffering with an opiate use disorder.
And everyone is going to be different when it comes to dealing with these different substances, as far as what level that they're on. I mean, it could be a casual type thing, and but then it could be serious.
Yes, because some folks, like I said, they're self-medicating, and their initial problem may be substance related, and then once they stop using the substance, they uncover a severe anxiety disorder, a depressive disorder that is foundational for creating some of those issues.
Well, if you need help, 800-831-1700 is the number to call and get some help here from Gulfport Behavioral Health. It's so good to see you, Dean Doty, CEO here at Gulfport Behavioral Health Systems. If you need some help for substance abuse on any level, no matter how big or small, give them a call, set them an appointment for a free assessment here at Gulfport Behavioral Health. They're located here on Highway 49 in Gulfport, north of I-10, right by the post office.